when there is a bone formation going on, there are some markers which rise in the blood and urine, like osteocalcin, alkaline phosphatase. These two markers are very important for bone formation. Serum procollagen type 1 and C is another one you should remember for the list. But what is more commonly asked is markers of resorption. Number 1, hydroxyproline. Nowadays, they are also asking you pyridinoline, deoxypyridinoline, and telopeptides. So when bone formation disorders are there, osteocalcin ALP, bone resorption disorders are there, the markers of resorption like hydroxyproline, when both formation and resorption are high, means the bone turnover is high, then you have a disease in which all the markers are high. Remember the classical name, Paget's, also called as osteitis deformans.